Hello and a very warm welcome. Today we're going to hold a really safe and gentle space to talk about something that is so personal, but also so important. And that's the connection between medication and our intimate comfort. It's a conversation that so many of us need to have. So let me just start by asking you, does this resonate? Have you ever felt a little shift? Maybe things just don't feel the way they used to? And you've had that little thought in the back of your mind, I wonder if this new prescription has something to do with it. If you're nodding along right now, I want you to really hear this. You are so far from being alone. This is way more common than we talk about, and it's a completely valid medical issue. It is not something you just have to put up with. I mean, just look at this number. For some of the most common antidepressants, up to 70% of women report having sexual side effects. So you see, this isn't some personal failing. It's not about you. It's not about your partner. It's just a known physical reaction that can happen with certain medicines. And to help us really understand all of this with clarity and compassion, we're going to be leaning on the incredible expertise of Dr. Farzana Khan from the Women's Health Clinic. She is truly a dedicated expert in helping women feel whole and well. And here's why we can feel so safe in her hands. We're talking about over 20 years of experience, a medical degree from Copenhagen University, and special diplomas in sexual and reproductive health. Her life's work is focused right here on our intimate health and well-being. And I just love her philosophy. It's all about partnership. It's not about a doctor just telling you what to do. It's about you understanding your own body, knowing all of your options, and then making decisions together as a team. Okay, so let's dive in. We're going to gently walk through some of the common types of medications that can sometimes be the culprits when we notice these kinds of changes. First up, antidepressants, especially a group called SSRIs. Now, these medications are absolute lifesavers for millions of people, but it is a known fact that for some women, they can have the side effect of lowering desire, creating some dryness, or making orgasm feel a little more distant. Next on the list are hormonal contraceptives. So things like the combined pill or maybe an implant, what they can do is reduce the amount of free testosterone that's available in your body. And since testosterone plays a big part in libido and natural lubrication, some women can feel that difference. Then there are certain blood pressure medications. It kind of makes sense when you think about it. Some of them, like beta blockers, work by affecting blood flow. And, well, if they reduce blood flow to the pelvic area, it can make arousal feel a little more challenging. And here's one that might actually surprise you, antihistamines. You know, those older allergy pills that are fantastic at drying up a runny nose? Well, they can't really pick and choose where they work. They dry up mucous membranes everywhere, and unfortunately, that can include vaginal tissue too. Okay, so knowing all of that is the first step. But what do we do with this information? Because knowing is great, but taking action is what's really empowering. So let's create a little plan for how you can have a really confident and comfortable talk with your doctor. A little bit of prep can make you feel so much more in control. Just take a few minutes to jot down every single thing you take, even vitamins or over-the-counter stuff. Then think back. When did these feelings start? And try to get specific. Is it dryness? Low desire? And finally, consider what else is going on. Stress? Sleep? It all helps paint the full picture. And if you're worried about how to even begin the conversation, here you go. Here are the words. An opener like this is just so perfect because it's not demanding, it's collaborative. It says, hey, this medicine is important to me, but so is my quality of life. Can we solve this together? Now let's talk about those little voices in our heads. It is so easy to worry that your doctor will think you're being silly. But the truth is, your sexual health is health. It's a vital part of your overall well-being. And please, I can't say this enough, never, ever just stop or change your dose by yourself. It can be really unsafe, and it has to be guided by a doctor. All right, and this leads us to the most wonderful and hopeful part of all this. There are options. There are absolutely paths to feeling better. So let's look at what some of those might be. Sometimes a simple switch can work wonders. For example, your doctor might suggest trying a different class of antidepressant that works in a slightly different way. Or maybe switching from a contraceptive pill to a patch, which can leave more of your natural testosterone free. And that allergy example, using a nasal spray treats the problem right where it is, locally, without drying out your whole system. And remember, it's not always about changing your prescription. There is a whole toolkit of other supportive things we can do. High-quality lubricants are a game changer, localized estrogen can be amazing for tissue health, and things like pelvic physiotherapy or counseling can be incredibly powerful for restoring comfort, confidence, and connection.
As we bring our conversation to a close, I just want to leave you with one final, really powerful thought. This is the heart of everything we've talked about today.
Please just take a moment and let that sink in. Your sexual wellness is not some frivolous extra. It's not a luxury. It is a vital, legitimate, and essential part of your health and your happiness. And it deserves to be cared for.
So I'll leave you with this question. What's one small, gentle step you could take for yourself this week? It doesn't have to be big. Maybe it's just buying a new lubricant, or maybe it's just writing down that list of medications. Whatever it is, what is one gentle thing you can do to honor your own well-being? Thank you so much for spending this time with me.